Joining me now for a wrap-up of this week's events in COVID-19 in the region of SDNG and Prescott Russell is our Medical Officer of Health, Dr. Paul Roumeliotis. Welcome, Doctor.
Good to be back.
All right, so Doctor, of course, the biggest news coming out this week was there was a confirmed case at a local business, and I'll get your thoughts on that case and update our viewers.
Yeah. There was a confirmed case at a local Tim Hortons. We get notified for every positive case that occurs in our area, obviously, and we do a follow-up. And in this situation, and as part of our routine follow-up, we have to contact the individual, obviously, see what type of work this individual does, see what the contacts are. So in the context of doing that, we discovered that this individual worked at a local Tim Hortons. Our main concern really is what type of work does this individual do. So what part of our contact tracing has to do exactly that. When was the individual infectious? When was the individual symptomatic? And what we do is we go back 48 hours. So we investigated the whole situation. We ascertained that this individual did not serve the public, was working in the back. And so we did not think that there is no risk to the public or anybody driving by. It's the toll gate one. At this point, what we're doing is we are obviously testing everybody else and isolating other workers because they were close in working together. The restaurant itself decided to close on its own because it wanted to clean up, but also a lot of their staff would be on self-isolation anyway as part of our follow-up. So I guess I want to reiterate that this was an individual working at a Tim Hortons, not serving clients primarily, basically in the back, and there was no risk to the way that the food was serviced or anything like that. So there was no risk to the public. However, as part of our contact tracing, we are following up on the individuals that worked with this employee and are doing the appropriate follow-up and testing. So once again, there is no risk to the public, and we are doing our tracing. The Tim Hortons elected to close the store on their own. I did not force the store to close. I do have the ability to close stores if I feel that it's a menace or a danger, but not in this situation. This was a voluntary move by the store itself.
And Doctor, another highlight this week was the Eastern Ontario Health Unit's website. The way that cases are being reported has changed. Yes. There's more interactive numbers as well as broken down between Cornwall, SDNG, and Prescott Russell. I'll get your thoughts on that as well as the numbers that we've seen this week.
Yes, I can tell you that one of the things that we were trying to do, and again, it has to do with the way the numbers are delivered and so on. I'm not going to get into the details, but the bottom line is that now we're presenting the numbers based on county. So, for example, Prescott Russell, SDNG, and the city of Cornwall. As of yesterday, we had 65 cases in total, 39 of which were in Prescott Russell, 16 were SDNG, and 10 were in Cornwall. So you can see that it is all over. It's really all over the area. It's a bit more in Prescott Russell, but that doesn't surprise me at all because a lot of the people who live in Prescott Russell actually work in Ottawa, and Ottawa has a higher rate. They have 700 cases or so it doesn't surprise me at all. However, I just want to reiterate that it is in our region. It is primarily affecting elderly and people who have underlying chronic conditions. At this point, we also report the number of hospitalizations, the number of ICU admissions, and the number of deaths. Fortunately, to this point, there are no deaths, but I want to reiterate that people may look at these numbers and say, "Oh, Cornwall has 10 cases," but we haven't tested a lot. We haven't tested everybody. For every case likely that we have positive, there's probably a couple of others out there. We want to be able to ensure, and the people understand that in Cornwall, in SDNG, and in Prescott Russell, the virus is here. So we need to act accordingly, and this is why we're doing all these measures. I also want to remind people that Cornwall, SDNG, and Prescott Russell, and particularly Cornwall, had among the highest rates of death and hospitalization during H1N1. And this virus is actually probably more dangerous than H1N1 was because it affects individuals who are elderly, who have chronic medical conditions, and unfortunately we don't have a vaccine nor a treatment. So this is why I don't want people to minimize the numbers and focus on the numbers. They need to focus on the fact that it's here. Look at our neighbors across the bridge. There's tens of thousands of deaths deaths in New York City area. And so we need to be diligent, careful, and don't take it for granted by looking at the numbers. Please do not minimize the numbers. Just accept the fact that it's here, and we have to do our best collectively to protect our population, particularly the vulnerable ones.
And when you talk about those protections, we know that we've been told for weeks about social distancing, staying at home has been a big message. But with springtime and the nice weather coming, there's a lot of questions. We know that Premier Ford has talked about he hopes that fishing season can go on as normal. A lot of people are asking, can they go for hikes or kayaking or things that they're not necessarily in large groups, but still outside. So I'll get your thoughts on that versus the stay home message.
There's no question that the stay home message becomes more difficult as we get into nice weather, and we are quite concerned about that. We're discussing that at the local level. I've discussed that with our municipalities, with our MPs, MPPs, as well as the ministry. Yes, we're now bracing ourselves to see, okay, what's going to happen over the next week or so, and we can then look at what can we progressively bring back, presuming that we don't have a jump in cases and presuming that we're continuing to start to see the flattening of that curve. So yes, I do recognize that there are abilities or activities that we would want to perhaps be careful about, social distancing and so on. But at the same time, we don't want a lot of people out at the same time. So we have to balance how many people are outside and potentially spreading the virus versus the ability to go out and kayak safely. So again, I do recognize that that is an issue. I think we should be patient for another week or two. It'll dictate to us where we're going to land with this. I do believe that if things go as they are now, if we continue clamping down, social distancing, staying at home, and so on, that we will be seeing that light at the end of the tunnel, and we'll be able to then start with those activities. But it won't go back to normal like a switch. It's going to be progressive. We'll say, okay, we can do this, we can do that. Perhaps we won't allow people to congregate for more than 10 or 20, those type of things. So I still think at this point, we have a week or two to go until the end of the month, because that's going to be a pivotal time into dictating whether we go up the curve or down, flatten, which will then trigger us being able to be more lax with our recommendations.
And on that note, Doctor, I'd like to thank you for joining me for this update, and best of luck as we continue through these trying times together.
Thank you.